Right. First of all, positioning, right? It's up to you to get your client into the correct position, because if they're not in the correct position, first of all, it's difficult to work with them. So straight away, what you would do is put one arm there and one arm there, make a fist, and you say to your client, all right, Maggie, just shuffle back for me so that your back and your bum are hitting off my arms.
Oh.
Right?
Yeah.
If they try and lean back and not shuffle back, the best thing to do is to grab the pillow, put it there, because then they physically have to move back, right?
Yeah.
Or what I do is I'll come like this and I'll pull them back towards me, because some people just can't get it, right? Okay, straighten your bottom leg, have your top leg up at right angles, all right? We want to have a support under the top leg, okay? You then want to have a nice big squishy pillow, and you say, just kid on, that's your boyfriend or your girlfriend, right? And you cuddle into that. When the client's nice and comfy like this, because I can spend a full hour working in the side position, right? So this is your client care. If you're going to be there for a while, it's brilliant for the client if they're nice and comfy. See if you've got a big guy and he doesn't know what to do with his arms, right? Or it's just not comfortable, or the knee's not supported. Even if you've done a good job, you want the client to have a good experience when they go out the door. So it's all these little things that say, I'm professional, I've got the right aids, adaptations here, so that they really enjoy the treatment as well, and it's not, fuck, my knee's banging off that bed, I wish she'd hurry up. It's all these little things that are super important. Right, the lateral line connects in here, okay? But then I would always release out the little toe, okay? It doesn't actually come into the little toe, but I would always work it, okay? And to be honest with you, if I'm on the lateral line has a relationship with the front and back lines, so I'll probably release out all the toes anyway. If in doubt, just open up all your taps in the beginning, okay? And we don't ever press, I'm just going to expose your leg here. You don't ever want to press, okay, onto the Achilles tendon area. That's kind of soleus, okay? You could probably start, again, belly of the calf muscle about midway. So that would be 0.1, 0.2, okay? And then I would come into, like what we do with the hamstrings and the quads, 0.3, 0.4, and then towards the knee, 0.5. The knee generally is always tighter at the insertion point for the IT band, and you can take it on a scale of 10 for a deeper experience, right? Or just do a bit of compression work, because again, we need 925 kilograms to release the IT band effectively. So what's the point of spending any time on it, okay? This is where I do the bulk of my work. Now the map that I showed you when we were working on the glutes, you've got your 0.1 here, piriformis is here, 0.2, 0.3, 0.4, and then on the hip bone itself, right, where you're coming into glute medius minimus area, 0.1, 0.2, 0.3, that's where you want to work at, still working through the towels, okay? So we bring make sure the leg's nice and straight, reposition your client if you need to get them repositioned, and you say to them, all right, we're just coming into the center of the glutes, fall forward when you feel me pushing, okay? Deep breath for me, please. Big sigh out, and fall forward. So tell your client to fall forward, so you're right in the center of the glute max. Scale of 10, where are you?
It's like a 10.
Oh, do you need me to back off?
Maybe a little bit.
Okay, so I'm going to have to back off. Take it to a 1. Now when you take it to a 1, you can excavate with your elbow if you're doing a lot of deep work there. So with your excavation, you just want to be on that point and just move it around a bit, okay? We can, through the towels, use our double thumbs and palpate straight away. 0.2 there on that piriformis. Breathe. Big sigh out. Fall forward. As it softens, the client's hips will open and they'll be able to fall further into it. Where are you?
Maybe a 6.
So she's a 6 there. And again, you've got your general map. I also know that she's super tight right there. So see, just with palpating, you can add in other parts too. How you doing in there?
It's like a 10.
Yeah. So I could actually add in other parts there to release that. Okay.
She's been doing this hip thrusting.
Yeah.
It's tight.
So with the glute medius area here on the hip bone, you want to kind of reverse it a bit. So I'm going to use my other elbow, get on top of her, breathe. Big sigh.
Yeah, that's a 10.
So she's a 10 there. So that would take, you know, a good 20 odd minutes to release that.
Wow.
Pulling the hips back, okay? And then we've got the side of the hip here, okay? So this is like the greater trochanter area. This kind of triangular shape, where am I? Yeah, there we go.
You can use my skin if you need to.
Yeah, it is, it's okay.
Okay.
So that kind of triangular shape is what we're after. So here we can come, this is really good for hip pain. Again, breathe. Here you go. Skeleton.
Okay.
Yeah, so I'm hardly touching her. How are you doing there?
Yeah, same.
Right, so she's an 8, I'll be up at 8.
Spots into the hair.
So you can spend quite a lot of time there
Wow.
working through towels, right? After you've done that, we then want to work with oil, okay? So at that point, I then have important to have a conversation with the client and say, all right, we're going to be working now with a little bit of oil just on this glute max area. Is that okay? We're going to put another towel here, and we're just going to be working manually with oil. So if somebody's in for the first time, or if it's a man, and you can feel sometimes if people have an energy with you, keep yourself really clinical when you're about to do this, because the client can get nervous. See, if you're too sloppy with it, they can get a bit like, this is a bit personal, I didn't know about this. Or if you've got a bit of a sleaze bag in, you want to let him know that this is you're in charge, and it's not one of those types of massages. Okay, so have
How do
that.
you tell it if it's what he said? It's a sleazy one. Hopefully not.
No happy endings here. Don't get it in your mind.
If you're in a clinic environment, it doesn't really happen, and it's all about your presentation. If you look really sexy as a massage therapist, then you get more guys coming on to you. If you really tone it down, and it's also the way you talk and the way that you are, it lets them know you're not available. Yeah, I think I probably had one guy in the past few years that came in, and he was just an arse, just an absolute arse, you know. I knew his wife really well as well.
Oh.
And he was just at it. He just had learning difficulties, and he was a builder, and he just was coming out with crap, you know. But I just cut him dead. I just let him know. Do you know what I mean? Like, just we're getting on with this. Taking them back to the breath. Deep breath. Use that breath skeleton. Like, sharpen your tones a little bit with them to let them know. Okay. So we take this down, and then you would tuck the towel in and actually come to the exposing the full bum area. Okay.
But they'd have shorts on.
Yes, shorts, or ladies would have pants, but you want to have full access to that area. Okay. And then using some oil.
Oh yeah, if it is a man with boxers,
Yeah.
you would work under the box. You need the boxers to be just pull them down.
Yeah, just like this, you just pull them
Slide
down.
it down.
So that's why you need to have the conversation, because if you don't have the conversation, they're a bit like, hey up, what the hell's this?
Oh, there
Uh-huh.
we go.
Yeah, okay. And then you can use a forearm to come over that as well. Right, now effectively what we're going to do is start there, and we're going to do our tracking with our elbow all over this area, and then she's going to tell me to stop on a scale of 10. Now that would take about 45 minutes to sort all of that out, because she's already told us she's up at an 8. But I'll give you a little demo of what it is, right? Again, hold on, right into the centre, fall forward. Okay, so where are you?
Yeah, 10.
A 10, so she's a 1. So I'm really going to take the pressure off to show you how to do this. When you're tracking, use your kind of lever. I call this the lever to move, because if you drag along the skin, it feels excruciatingly painful. See, if you lever, you can get a better grip of the muscle tissue when you're doing that. So just lever all your way around. How you doing there?
There's good.
Yeah, she's okay. And then levering forward. I'm moving now this way.
Yeah, that's crazy right there.
Right, and now I'm going to move this way. So I'm levering now towards the kind of piriformis area. How you doing in there?
Yeah, that's safe.
Okay, so I can lever in that way. You can pull it back, give it some love, let it breathe. Okay, now the area here, this is glute medius minimus coming off glute max. You then want to come up with an elbow and lever. Right, how you doing?
Yeah, that's a 10.
A 10, and again, how you doing in there?
10 still.
Right, pull it back, give it some love. Okay, then we're going to work into the hip here at the front. Okay, so remember, it's that kind of triangular area that we want. She's quite small, so again, I'm coming in with my spot. How you doing in there? Yeah, she's okay. So you can use your tracking system, give it some love, and then for a deeper experience, how you doing? Yeah? You can use your lever in there as well. Okay, so that's how you treat the glute max. I do a lot of work. This is very good for piriformis syndrome, sciatica that's not been affected by L4, L5. If people are in with tight glutes, tight lumbar area, this is brilliant for relieving that type of sciatica. Sciatica that is to do with disc damage, you wouldn't do this, okay? So if anything comes up, remember, always do no harm, right? Okay, so you'll do a lot of work like that, do that for me, and then I'll show you how to take it out the top.